So, how do I know when it's time to consider euthanasia for my pet?
Yeah. So, gosh, that's the big question, right? It's tough and there's no perfect answer. What I like to recommend is, we think about good days, bad days, and that can be even moments, good moments, bad moments. And, that can be if your pet has normally, maybe sleeps a lot during the day, but still can follow you around or do the kind of normal behaviors. We're eating okay, we're drinking okay, all our ins and outs are good. Okay, we're seeing your pet. I wouldn't expect much more than that. But when we start seeing a decline, so maybe they're not as attached to you, that kind of bond is changing, or maybe we're doing some pacing, maybe we're getting stuck in corners, or, we're a little bit off food, not drinking as much, those kind of like real subtle things sometimes. When those
Mm-hmm.
start building up, I call those like your bad days or your bad moments. So thinking about it that way and looking at like the previous week, the previous month. And if we start getting to like 50-50, I think that's when
Mm-hmm.
you need to start planning because no one wants to have more bad days than good days. We all want to have more good days. So, why wait? We're just prolonging suffering, prolonging pain. And there's no, like, you don't want your loved one to be in that situation and be suffering. So if we're at 50-50, I think that's a good time to reach out either to your primary care or to a service like Heartstrings and have us either come in and do like a quality of life assessment, even maybe
Mm-hmm.
consider hospice care, if that's what we're thinking, or just planning to go ahead and say, hey, I'm like at 50-50 or 60-40, bad days to good days. I don't want my loved one to suffer. I think it's time to say goodbye, and that's totally appropriate. There's a big gray zone, of trying to make that decision. And there's no right or wrong answer. There really isn't. Everyone's, different. Everyone's life and bond with their pet is different. And so the best thing is to try to focus on making something that's very subjective to be more objective, with those numbers, the good days, bad days. And so that's simplest way I can think about breaking it down because it is a hard decision.
What is the process of pet euthanasia and will it be painful for my pet?
So the process is essentially two steps. And we give a sedative first, and it's a sedative, and
Mm-hmm.
there's pain control in there. There's a muscle relaxer in there, and we give it like you're getting a vaccine. It's under the skin. Sometimes we'll give it in the muscle, sort of depending, but it is a shot. So there's always that little pinch. I like to do, and a lot of my doctors like to do distractions, whether that's letting the pet eat something while we're giving that shot or doing like a lot of scratches kind of around that area, sort of a sensory distraction,
Mm-hmm.
or just having the family sort of pet them and love on them and, do something that gives them comfort while we're, giving that little vaccine, that little injection in the back. So that's the first step. And it typically will take, anywhere from, a minute to, several minutes. It sort of depends on the pet, depends on how we give it, but they will slowly, fall asleep like they're having surgery. This is, essentially anesthesia that we're doing.
Mm-hmm.
And so they, will look like they're in a deep sleep. Their breathing pattern might change a little bit. It might be shallow or not as frequent, or sometimes I would call my forgetful breathers, where they'll kind of hold their breath for a little bit and then they'll take these big breaths and then they forget to breathe again and they'll hold their breath. And so we see all these different patterns, very normal, nothing to worry about. But then also, what I also explain to families is that they typically will have their eyes open, which, can kind of freak people out. It freaks
Yeah.
me out sometimes, but they'll have a sort of a fixed stare, which is a big sign that they're sedated. And so that's, we're trying to get to that point essentially. And then when we do the second step, there is zero pain. They are unconscious. They are pain free. They have a lot of good medicine on board. So I like to think of them as already dreaming off in La La Land, chasing them squirrels, and then when we do that last step, they don't feel anything. It's very quick. It does go into a vein, and most of our doctors like to start with a back leg if we can do that. And that way the family can just be at the front end and loving
Yeah.
on them and petting and talking to them. So, and within a few seconds to a minute, once the medicine is in, they'll just pass peacefully. And so with that, you can again see some breathing changes, which is very
Hmm.
normal. And then they just stop breathing, and then the heart will stop shortly after that. And so that's when we check. So, our goal is to make it as peaceful as possible and, make it that kind of calm experience. Now, I always like to give the disclaimer that death can be unpredictable and
Hmm.
death is ugly. And sometimes it can be traumatizing, and we can't always predict those things. It's rare. I will say it's rare though. But with these two steps, with the sedative, muscle relaxer, pain control, and then doing that last step when they're completely out, it will tend to prevent those kind of traumatizing things that you could potentially see. But that, again, being at home, taking that stress away, and then doing these two steps, I think really 99% of the time, it's going to be a really beautiful, peaceful experience.
How can I prepare myself and my family for the loss of our pet?
Whew, it is tough. I feel like our grieving starts, as soon as you really even think about this process or the idea of
Hmm.
making this decision, you're grieving right away. And then you have to make that call. That phone call is so hard, and you can already start crying and getting very emotional then. And then you come to the day, and it's even harder. And, so how do you prepare? That's a great question. And I don't have a perfect answer. I think it really depends on the family, whether that be you do kind of all your bucket list items that's left, whether that be taking a beach trip, taking a mountain trip, going to their parks that they love to go to, or, doing all these things that your pet really loves to do, even if it's just sitting outside in the sunbeams. How beautiful is that? So you can kind of prepare, I think, by doing those bucket list items so that you're getting that good time, those good memories before you have this really hard day. And then I think that makes that day a little bit lighter. It's just one of these things we're just trying to make a really tough experience a little less difficult. And so other things that, families can do, you can plan out these, kind of memorial ceremonies or prayers, poems, songs, all these things I think are helpful that kind of give us that peace within us that we're making the right decision. We're showing our love and our affection, and showing off that bond, that we have with them. And I think that helps the grief process a lot. It helps us kind of, process our feelings and emotions. And then, of course, talking to a professional, getting a therapist, having,
Yeah.
someone, even just a good friend that has a good listening ear, having that support system is a huge benefit. And it could just be somebody that you talk to on the phone, that you do video calls with, that's there with you. You can, go out for coffee or whatever. So you just need somebody sometimes to talk to and kind of vent. And so I think that can help a little bit. And you can lean on your family, friends, professionals, anything like that, I think can be very beneficial. I love
Well,
that.
I think this was very beneficial. I think it's very helpful to kind of explain the process with euthanasia and everything so that people aren't as scared and worried about their pets being in pain. And I think all the knowledge that you shared today is really going to be beneficial for people that are going to start thinking about this process. So I appreciate you for sharing all of that with us.
I'm happy to help.
Oh, thank you.